Hi, and welcome. I'm Dr. Beth Claxton. I am a board certified obstetrician gynecologist and certified functional medicine practitioner through the Institutes for Functional Medicine. And I have with me today Jenn Pike. And Jenn, tell us about you.
Hi. Well, thank you for having me on the show today. So, I'm a medical exercise specialist and a functional medicine practitioner that specializes in women's health and hormones. So, for me, I'm working on everything from period issues and cycle regulation. I teach a lot around cycle syncing and cycle awareness, supporting women with their nervous system and adrenals and thyroid, perimenopause, menopause, and beyond. And yeah, there's never a boring day when it comes to, as you know, this working with women's health. And it's something I'm really, really passionate about, especially teaching our young girls, which we're going to talk about today, because so many women, I'm sure you have this in clinical practice as well, they come to you in their mid 30s, their 40s, 50s, and beyond, and are so disconnected from their body. I feel this is happening. I don't know why. I don't understand. They don't feel empowered. If anything, they feel disempowered and dismissed. And I've just really made it, my mission over the last 26 years in practice to, at first and foremost, just educate, get women asking more questions, be more connected to their body, have the awareness, listen to our bodies when something does not feel right. And to do it in a way where we don't feel embarrassed or shame or, grossed out by anything that's happening, and to recognize just how absolutely incredible our female bodies are.
Yes, yes. And thank you for making this your mission.
Yeah, thank you.
So I'd like to talk today about girls and their periods, and especially athletic girls and training, and so that they can watch this video and get a sense of what would be the best way to train when they're in school sports, tracking their cycles, and ways that they can support themselves while doing these athletic endeavors in a stressful time in life.
Yeah. Oh my God. Well, and that's it, is that we're talking, if they're in high school and preparing to go into college. I mean, these girls are between the ages of 14 and 18 years old. So they're passionate about their sport. They love their sport. For many of them, the sport is also connected to their education and scholarship or where they're going. But this is also a critical period of time in our bodies as women where there are so many changes happening. So many changes. So in that early period of time, most girls somewhere between the age, it can be as young now as 8 or 9 years old, but between that period of time and, 15, definitely by 16, are going to have their periods. So there is a huge influx of hormones that are coming on the scene, robust amount of estrogen in our bodies, which is why the shape of our body will change. Our mood will greatly fluctuate. And in that period of time as well, this is when the body is starting to regulate itself and regulate ovulation. And this is where we can have these highs and lows of estrogen and progesterone and testosterone and energy overall. And so for most tween and teen girls, they'll recognize their moods change a ton, and a lot of girls, when you spend time talking to them, will say, I don't know why I'm sad, I just am. I don't know why I'm mad, I'm just am. I don't know why I feel anxious, I just do. I don't know why I'm fearful or what, I just am. And so it's like they recognize and understand that they're feeling off or feeling different than what they would describe as normal, but they don't understand why. And, when it comes to training, whether it is like their practices, their dry land training, accessory work, or actual game time and getting in and doing the sport, those sports are requiring a certain expectation of us body-wise, energy, performance, recovery. But then it's also this body that we're doing that on top of. And so when I'm working with women and young girls, and that the first thing is trying to get them to understand the importance of actually tracking the changes in their cycle that they're noticing. So, for girls that are listening, we can understand that, say in school, you have report cards, you have midterm reports. This is like a benchmark of checking in, like, how are we doing? It's the same thing in sport. You'll have evaluations, you have tryouts, you have, your regular season that leads into, tournaments, championships, whatever. They're all checkpoints. Our period is no different, and our period is a monthly report card. helping us to understand in our body as a whole, like how are things actually going? So if you have a young girl who has a regular menstrual cycle, which let's define regular, because it's not just 28
Yeah.
days. There is a range depending on
Mhm.
what's going on. So anywhere from a 24 to 25-day cycle in the upwards of sometimes a 35-day cycle, but one that is regular, not one where it's like 1 month it's 24 days, the other month it's like 42 days, and then it might skip a month. That is having an irregular cycle. But if we have these regular cycles, and we can talk about some of these nuances, then it's like, okay, so using a tracker on your phone, there's tons of free period tracking apps. I try to get girls to use the simplest ones possible. So I really love, period tracker is easy. There's a great one that actually incorporates a lot of information around exercise and sport called Wild AI that Dr. Stacy Sims is part of creating.
Okay.
And she is a physician that focuses specifically on females' strength training, movement, exercise, and then applying our cycles to that as well. So those are ones, because what that's going to do for the teen or the young woman who's tracking that is, as it starts to learn her rhythm and her cycle, it'll say like, oh, you're in your follicular phase. This is a great time to lift heavy, to push a little harder, to make sure you're getting ample, protein and carbohydrate at this time post workout. And this is what's important for us to know as women. So tracking your cycle is important. The other thing inside a lot of these apps is you can track your symptoms. So tracking would mean that you start to track like day 1 of when you bleed, the last day of your period. So that's actually your period. Your cycle and your period are not the same thing. So your period is when you bleed. And then your cycle really counts as from, like, if I got my period today, all the way through until I get my very next period. That's my actual whole cycle length. And so I think I work with women in their 40s who did not know that. They thought like the period and the cycle are the same thing. So I think that's important for them to understand. But what I really love about the tracking as well is, do you have headaches? Do you have breakouts? Do you have bloating? Do you have backache? Are you nauseous? Do you throw up from pain from your periods? Do you feel anxious? All those things. And then what's really nice, Beth, is that as we do this month over month, I've been tracking since I was 17, I'm 43. As you track this month over month, you have all of this data. And it's beautiful because a lot of these apps will graph it. And now you can actually start to see what is normal for you, not what's normal for all your girlfriends or other people, but what's normal for you. And then if there's something happens in life where you get a period a lot earlier, your period is late, something is different, you can now look back and be like, okay, that was off for me. Well, what happened in life leading up to that time? Was I more stressed? Was I maybe not eating enough? Was I staying up too late? Was there inflammation in my body? What was going on? Did I have exams? And then you can start to pinpoint and understand, and then start to put things in place to get your body back on track.
Right. And it's so easy to become disconnected for everyone. And
oh yeah.
They, especially the young girls, they think they can stay up late. They think they can do, and then things happen. They get injured.
Yeah.
Period. They miss a period, or it's late. Yeah, exactly.
Yeah, they get sick, something throws it off. It's like, I have, two teens. My oldest is almost 17, and that's my daughter. And my son is, almost 15. And yeah, and they've grown up, I'm sure, like your kids in the household, where this is just like normal talking conversation. And it's not to say that they still don't, have teenager habits and do those things, but they'll pick up on it quicker. And like, it'll only take my daughter a period of time where she's like, I got to get my sleep back on track. I gotta turn my phone off earlier. I need to like not have it in the room. I need like those kind of things because they just start to feel their body not feel great. Yeah. So I think when we're talking about like understanding training, because I'll break it down in the 4 phases of what training would be great. But now the challenging piece is, your coach is not necessarily going to be like, okay, here's your training program based on your period, and here's yours based on, yours and
Right.
all of that. So this is why it's important for us as the girl, as the woman, to understand this, so we're informed, so we know this is what I got in me, and then this is how I have to take care of myself. So that first phase, which is called the follicular phase, is once the period is done and now the bleed has stopped, which most women will say, like, this is when I start to feel good again.
Yeah.
My period is done.
Mhm.
I feel calmer. I feel more connected. I feel clear. I have energy. That follicular phase is when we are now starting to see estrogen come up on a rise, and testosterone will start to come up. We have our follicular and luteinizing hormones that are going to be coming in as well. And that really supports our body ligament wise, tendon wise, energy and strength wise, to lift heavier and to maybe push a little bit more than we would have been able to do in our period. So that is that period of time. Coming into ovulation, we can typically still maintain that same type of energy and performance and feel pretty good when we come on the other side of ovulation. So, our period is what we've been taught always is like the most important part of the cycle. It's the most obvious because it requires us to change some of our daily habits when we have our period. But ovulation is actually the most important marker of a healthy cycle overall. And so when we ovulate, means that the follicles on the ovaries have matured and ripened enough to the point where we release an egg and ovulation has taken place. And after ovulation, we now move into the third phase, which is the luteal phase. And that is the longest phase, especially for teens. Most teens are going to have, generally about 2-ish weeks from the time they've ovulated until they get their next period. This can be where if there's any inflammation happening in the body and the lifestyle, nutrition wise, and that, where the mood swings can come on, the achy breast, the tender back, especially the 5 to 7 days before the period, is where most women will say that, PMS, like premenstrual tension syndrome, can start to come on. The mood can be impacted, sleep, gut. There's a lot of different things depending on the woman. That period of time, you can still be doing your workouts and your sport, but you're thinking more from like a kinesthetic place. You're not going and crushing it. You're not trying to do like your hardest workouts, your biggest lifts, your fastest run, whatever it is that sport or life is asking of you. You're really trying to dial it in and focus on your form, your technique, like your actual efficacy of like how you show up and efficiency in what you do. Like this is where performance comes in. So it's not about like the grunt work. This is dial in time.
Yeah. Good.
And it's about precision. And then when we come into our period, in an ideal scenario, the first 48 to 72 hours of our bleed would be where we have the opportunity to go into recovery and to deload our training, to step back from crazy schedule, to really nourish our bodies, hydrate, minerals. I mean, we need that all the time, but I don't think that most women recognize that you don't just have a bleed, you're shedding the lining of an organ, your uterus. It's big work. It's big work. Yeah.
And nurturing, and like Epsom salt baths and foot massages, like everything we can do to really nurture ourselves during that time of bleeding is I also work with Ayurveda. So just
I love it.
turning inward and just really like that deep nourishing. And I also wanted to say during that luteal phase, I remember, like, I haven't had a period in a few years, but I do remember like the cravings, the carbs, the chocolate, and those tend to be inflammatory foods. That's an inflammatory phase of the cycle. So whatever we can do to avoid that maybe even eating more protein to
Mhm.
help offset those cravings. What are your thoughts on that?
For sure. I mean, we have a higher rate of prostaglandins that are being released into
Mhm,
the body, which is what's
mhm.
producing that inflammatory response. And
Yeah,
our brain and our nervous system are hardwired to go and look for things that are going to get us at a dodge quickly.
yeah,
So give me sugar, give me dopamine, give me oxytocin, make me feel good.
yeah.
And so that's why we reach for the sugar, the salt, the processed foods, that type of, call it comfort food. But if
Mhm.
we can keep our blood sugar stable, if we
Right.
can get enough protein and good quality sources of carbohydrates in so that we're more grounded, we're
Mhm.
not going to feel like I've got to inhale everything that's not, nailed down around me. And we have to understand too, if we're reaching for like, I have to have the chocolate, I need to have the salty chips and all of that, then I'm really am asking like how well supported is your body, and we
Right.
need more minerals. Are your electrolytes supported? So with athletes, it's also looking at like that sodium potassium ratio. And
Mhm.
I make sure, I don't work with a ton of athletes anymore. Now I'm working with women who are athletes of everyday life that are doing a lot of strength training,
Yeah.
bigger workouts, you know and so for that, it's making sure, do you have something like element in your water, like a
Mhm.
packet of element, or are you adding in some BCAAs and some really good quality salt in there?
Yeah.
And those can be, especially like for our teens, like for my kids, when they're like, my son plays hockey at a provincial level, my daughter is at the gym, a scoop of that or a packet of that into their water, super easy. It's not
Yeah.
asking them to go and pull out a cutting board and
Yeah.
a knife and like
Yeah.
make anything. They just have to literally open it and put it in there. And I think too, in that same vein of talking about that, especially for our girls coming into their cycles, I'll always say to my daughter, okay, you've got like your minerals in your water, take a naked shake with you as well to have right after your workout if you can't eat right away.
Mhm.
So just a scoop of protein
Mhm.
powder, and whatever dairy or non-dairy source she's using, or even water, just to get that bolus of protein in, get something into her system so she doesn't crash and then,
Yeah.
want to reach for something that's super processed.
Yeah. Great. And then can we talk a little bit about fats and
Hmm.
the importance of fats, and the seed cycling could be such a nice way to introduce these super healthy fats
Yeah.
that are
So
balanced.
getting our a healthy amount of omega-3 fatty acids and
Mhm.
saturated fats are really important, especially when we're in our hormonal years, because, cholesterol is what is essential for producing our hormones. And if we don't have enough fat, if we have a diet that is just, carbohydrates and, lots of calories, but devoid of healthy nutrients,
Mhm.
it's very difficult for our body to be, in equilibrium, to be in balance. And those healthy fats are going to help with your skin, with your hair, with your nails,
Mhm.
cognition, energy, brain function, hormone production. So seed cycling, which the practice of seed cycling is in the first half. So from that period of time when you bleed until you ovulate, you would use 1 to 2 tablespoons of either ground flax or pumpkin seed, or you can do a combination of both. And those are rich in gamma linoleic acids and the
Mhm.
same type of properties as the hormones that we're trying to support in the body in that first half, which is a more estrogen rich period of time and sending all the right messages from the brain to the ovaries to get ready for ovulation, the main event. But those seeds also help to add beautiful sources of fiber so that digestively
Mhm.
things are supported. We're having healthy poop. It's the other thing that doesn't get talked about is poop. And I talk about it all the time, because if you're constipated or you're having very mucky bowel movements,
Mhm.
that could actually be a huge sign and indicator of why you're having really bad periods, bad PMS, the bloating, all of that discomfort. So adding something as simple as nuts and seeds in to, your breakfast or into your yogurt or into a smoothie, however you want to get it in, is a
Mhm.
great way to do that. And then in the second half of the cycle, where we're now in that luteal phase, after we've ovulated until we get our next period, now we change up the sources of the seeds and we go to sesame and to sunflower. And so those are really beautiful at supporting the hormonal needs in the second half of the cycle and continue to support not only your digestion, but throughout this whole month, if you're using the seeds, you're more satiated, blood sugar
Mhm.
is supported, gut support, vitamin E, manganese. Like there's so, even if somebody was to say, seed cycling doesn't do anything for my cycle, there are so many other benefits for your human body.
Right, exactly. And also I was connecting some dots, the symptoms that girls have, women have in the luteal phase of the bloating and the not feeling well and feeling heavy and breast soreness and mood swings and cramps, all of that could be signs of excessive estrogen or toxic estrogen buildup. And so having those pumpkin and flax seeds in the first 2 weeks of the cycle will help clear that out as it's happening and into the bowels and cells and moving it out.
Yeah, it helps to support our phase 2, which is, phase 1 is the gut and the liver when we're moving it through first pass, but coming into second pass, I mean, this is where we have to methylate and conjugate, which essentially in English means that you have to the body's broken down those hormones into a water soluble nutrient. And now the body is amazing. Now I have to pack it up and wrap it and put bubble tape around it and a bow so that it doesn't escape and that doesn't interfere and cause trouble up top. And then I got to ship it out, which the shipping out is your poop. Right? So it's when we think about it from that perspective, for so many girls who have really painful periods, horrible headaches, throwing up, the first couple of days are just awful. And then they're gone and put on something like the pill right away. I'm always can we give it 3 to 4 months and try some of these lifestyle habits first, because we can reduce her discomfort by literally half, if not all, if we can start to put some of these things in place. And it's huge, because when that's happening, oftentimes it is unbound estrogen. So you could have a woman or a girl who has healthy estrogen, but she doesn't have enough progesterone, which as a teen is very common because it takes years for the cycle to fully regulate and for regular healthy ovulation and that luteinizing surge to happen. And so majority of girls are put on the pill between 15 and 17, which are the critical years for that to take place. And obviously it's a very personal decision, but I think what's so important is that as mothers, we're informed about all the bits and pieces, and our girls fully understand what it means to go on hormonal contraceptive. Because if it's strictly for pain and it's not for birth control, there's a lot of other things we can do to support.
Yeah, totally agree. And then the long-term effects of the birth control pills is the microbiome. And I see so many people down the line who, in their perimenopause imbalances probably from early use of birth control pills. And that being said, they definitely have their place. We don't want to get pregnant.
100%. And that's why I say it is a very personal decision. But with anything that we're choosing for our body, we deserve to be informed about all the information. And so we're so fortunate now that there are incredible books out there that share all different sides of the conversation, and that there's episodes and podcasts like this. And, there are certain platforms that's what they're dedicated to, is not saying don't do it or don't do it, but here's all of the information so that it's an informed decision. Because like anything that we choose for our body, and some women will go on and off the pill and have no problem.
Right.
But for the ones who do suffer from post-birth control pill syndrome, it can be years of rehabilitating their system. Yeah.
So in the last few minutes, let's just recap, follicular, ovulatory, luteal phase training. And so what are optimal?
So follicular and ovulatory, you can push a little deeper as long as your adrenals and nervous system are you got the green light for go. You're gonna lift heavier, and those are performance periods of time. Luteal is when you are still going to show up, but it's more about really the quality and how you perform and what it is that you're doing. And so maybe your load is a little bit more moderate, a little bit lighter, but now your progressive overload isn't coming from lifting the heaviest, it's lifting a moderate load, but now maybe you're doing more volume, so more repetition. exhaustion. Your cardio in the first half could be a little bit more, stimulatory, as where in the second half, walk, do something that's low impact. We also, as estrogen has that dip coming into our period, we don't have the ligamental support as much. So we're more prone to injury, specifically through the sacroiliac joints, low back, SI, sacrum, right? All of that, as well as the knees. So if you're doing something that is high impact in that last bit before your period, change it up. And this is how you build cross training into your training as a woman. It's like the first half, this is where we show up and we do the harder work. Second half, this is where we are in not lying down on the couch mode, but more recovery mode. And this is going to keep your body metabolically, muscle tissue, your adaptation on its toes. And you're actually going to, I see time and time again, women's lifts and strength and endurance improve when they do this versus following the same program every single day, year round. It's just, we're not built for that.
Yeah, we run in cycles. And then a period, nurturing, nourishing.
Taking care of
Yoga's
yourself. Pilates, yoga. Like I said, my favorite is walking and get outside, be in nature. I think it's medicine, it's therapy. Let your mind just process, getting rest. If you can get soft tissue work done, massage, or using like yoga tune-up balls or a gorgeous ball for the diaphragm, and really, especially as an athlete, unwinding all the areas that are so tight and working so hard for you all the time. Breath work is so important to help regulate your nervous system and your vagus nerve. Getting adjusted chiropractically, osteo, acu. There's so many things we can do. Free things are sleep, natural light in the morning, stay hydrated. When you're getting ready for bed at night, spend time, enjoy your face care routine and massage those oils into your skin, and really love on yourself. Read something that either brings you joy, is funny, creates a heart spark before you go to bed, versus scrolling Instagram and TikTok.
Oh, yes, exactly. And then sleep cycling to help detoxify and give the healthy fats to the hormones that are being made.
Absolutely.
Yeah, so much. This was great.
Yeah,
this
you're
was
welcome.
Great.
Thanks for having me.
And you're welcome. And where can people? Instagram, what is your YouTube channel? Lots of great content there.
Yeah, so honestly, my name, Jenn Pike. So if you put my name, Jenn Pike with 2 N's in Instagram, you'll find me there. YouTube, you'll find me there. On the internet, you'll find our website. So everything is under Jenn Pike. And yeah, that's the best place. And then my podcast is called The Simplicity Sessions, and our Monday episodes are all about women's health and hormones.
Beautiful. Thank you so much.
Thank you.